My name is Laha Alizada, and for my presentation, I will be presenting nursing burnout. First of all, what is nurse burnout? Burning is an occupational hazard, especially in nursing. It is a syndrome made up of emotional exhaustion and decreased personal accomplishment. What are some facts about the nurse burnout? The rates of stress and burnout among nurses have been found to be higher than the rates among other healthcare professionals, with approximately 40% of hospital nurses having burnout levels higher than the norm for healthcare workers. Another fact about nurse burnout is that burnout is the single bigger factor that is driving nurses out of the industry. Another fact is that every 1 in 5 nurses report that they intend to leave their job place within the first year of starting their work. So, what are some of the risk factors for nurse burnout? Some of the stressors that can lead to burnout are work overload. That is when you have too much work that you have to do in the 12-hour shift. A lot of the times when we as nurses start our day, we think, oh, well, it's going to be an easier day, or I only have 4 patients, so it's not going to be that hectic. However, that's not ever the case. A lot of the times when you even have lesser patients, your work overload is so much that you cannot get all of your work done in the 12-hour shift. That is when you give report to your oncoming nurses and then you still sit behind the computer and still keep charting for an hour or 2 hours after that, even though you have to come back the next day. This can affect the floor nurse and the student nurse as well. Another factor that can be a stressor that will lead to a burnout is not having any breaks. By law, every nurse that works 12-hour shift is required to take 30 minutes of uninterrupted lunch breaks. That means you pass your pagers, you pass your beepers, you pass your phones to another nurse to keep a check on your patients for the 30 minutes that you won't be on the floor, so nobody bothers you. Another factor is low self-esteem. This, of course, happens a lot of the times with our brand new nurses. Either they already have the low self-esteem when they come into work, or it's the fact that they cannot get their job done and they feel like the oncoming nurses that ask them 50 million questions is judging them for them not knowing the answers to certain questions or not having done a certain thing the way they would like it to be done. Some of the nursing interventions that I am talking about in this particular project is that if we have 90 minutes workout sessions or 4-hour retreat zones or yoga classes where we can go ahead and relieve all the stress from work. A lot of the times we think, oh well, I am so tired, I actually don't want to go work out. Or I am so tired that I just want to go put my head down and sleep. But actually, study shows that if you take 90 minutes out of your day, out of the week even, and then you do workout, that'll decrease your stress level. And also, 4-hour retreats will work as well. However, some hospitals do not have 4-hour retreat zones, so it's like shooting for the dot. But if we have 4-hour retreat zones, that would be the best solution. That is when, if you feel like you're stressed with like throughout the day or in the middle of the day, you think that stuff is just keep going on, you don't want to just clock out and leave home, you basically pass your beeper and your phone to somebody else, and then they take care of your patient while you go and de-stress basically in an area. What are some of the risk assessments that we can do as nurses? Well, first of all, if we do have the stress, first thing we need to do is recognize that we have the stress. The second step in the process is to make sure that we can reverse the stress burnout. This is done by either talking to somebody or recognizing that you have it and trying ways to see what will help you out in order to decrease the stress level. And the third thing to do is be resilient. Try if you have the stress burnout from nursing, then try to make sure that you keep doing what you're doing in order not to get it back. And also keep this in mind that it may seem that there's nothing you can do about your stress level. Your career will always be demanding, but you have a lot more control than you might think. Here's my references. This article that I reviewed in this project provided evidence to support the best practices for dealing with nurse burnout. This literature answered my PCOT questions by answering the reasons for burnout and how to relieve the burnout. Thank you.